Welcome to Surgical Technology. For many of you, you've never even heard of surgical technology, so I'm here to let you know what we are all about. We are considered the sterile technique people of the operating room. A lot of people think all we do is hand instruments, but that's not the fact. Our program takes 15 months to finish. There's a year and a half of prerequisites prior to getting into our program. We do not have a wait list, but we do have almost 3 job offers for every graduate. I'd like to show you 3 different aspects of what the lab would be like. Our lab is 2 quarters out of 5, so you learn a lot in lab. First thing I want to show you is Casey is over here showing us how to create a sterile field. This happens in every surgical procedure, and we practice this in our lab. She is creating all the sterile items necessary for a surgical procedure to occur, and she does it with perfect aseptic technique. After she creates the sterile field, I want to draw your attention over to Rick. Rick is now scrubbing his arms, and he is now trying to make himself as aseptically inclined or clean, let's say, prior to putting on his gown and gloves. Every surgical team member does this prior to putting on their gown and gloves, every surgeon and every person at the sterile field. So we teach this in addition to everything else. There's a lot to learning how to scrub your hands and do it correctly. After Rick has scrubbed his hands, then he would be then coming over to this area where Skylar is now getting ready to create her sterile field. I'm going to go ahead and turn Skylar in her gown because I'm a unsterile person and she's sterile. So there's some aspects to an unsterile position, such as mine. Now she's going to go ahead and start creating her field that she's going to work off of. So she's going to arrange her table. And eventually, she'll be bringing in a lot of instruments that are going to be all very specific to whatever surgical procedure she's going to do. That's what a lot of the program is about throughout the rest of the year that you're in the program. It's learning about all of the surgical procedures patients may have. It's learning what type of instrumentation they might need to complete that. And it's also understanding the function of each instrument, and then how do you hand it to the surgeon. Because surgery is all about how many minutes you're in the operating room. They charge by the minute, which means ultimately we have to be very fast and extremely responsive to every need of the surgeon and the patient. We are somewhat of a team sports type health career. So if patient care is not your bag and you haven't really got any thoughts toward health careers because of patient care, we are not patient care kind of people. Not that our patient isn't important, but we tend to be more team sports. We are given duties to do, and each person in the operating room then has a very, very important duty to complete. Surgical technology, I think you should give it a try.